Welcome to Clinical Confidentials. A 67-year-old patient presents with 4 days of a cough, shortness of breath, and pleuritic chest pain, and a fever. Before you jump into any treatment, what is your differential diagnosis? Drop your differential diagnosis below. The next step is coming in 5 minutes. Okay, Clinical Confidentials Part 2. Here's where most people miss the diagnosis. You do a head-to-toe exam. You notice increased respiratory rate, shallow breathing. You palpate tactile phragmitis. You percuss dullness, and you auscultate crackles, bronchial breath sounds. And the patient notes that they've had rust-color sputum. What are you thinking now? Let me know below because the diagnosis reveal, it's in 5 minutes. Okay, Clinical Confidentials Part number 3. You should be thinking pneumonia.
On physical exam, signs of pneumonia may include tactile phragmitis, which is often noted over areas of consolidation due to the fluid or infection in the alveoli, dullness to percussion over the affected lung area, suggesting consolidation or pleural effusion. On auscultation, you may hear crackles or rales. Inspiratory crackles are often heard over lung fields due to alveolar fluids. Bronchial breath sounds heard over consolidated areas where normal breath sounds are replaced with more harsh, hollow sounds. Unilateral wheezing or rhonchi. Digophony, which is that increased A to E change in voice sounds, indicative of consolidation. And tachypnea, due to the body's attempt to compensate for impaired gas exchange. The diagnosis of pneumonia typically involves a combination of clinical evaluation.
How would you confirm this diagnosis? Drop it below. The next video, treatment, it's coming up in 5 minutes. Okay, Clinical Confidentials Part 4. This is how this will show up on your exam. Rule number 1, remember, read the last sentence first. Identify what they're actually asking, not the diagnosis. It's asking for a treatment, but it doesn't give you the diagnosis. So let me know below what you're thinking. Clinical Confidentials number 5. For uncomplicated CAP, you would think MAD, macrolide, amoxicillin, or doxy, but look closer. This patient is 67 with diabetes, hypertension, and a smoking history. Comorbidities change treatment. So, what should we do now? Let me know below the final answer. It's coming next. Okay, Clinical Confidentials Part 6. Because of the comorbidities that this patient has, you need more coverage. So, based on the answer choices that you have, the correct answer is C. Video 7, it's coming next, and this is if you knew nothing about this question at all. Okay, welcome to Clinical Confidentials Part 7. Okay, if you got this question and you knew nothing about anything, MAD, crackles, macrolide, amoxicillin, and doxy. You also know crackles. Crackles stands for comorbidities, rust-colored sputum, augmentin, combination therapy, chest x-ray. Know that if the chest x-ray is normal, it's not pneumonia. L, Levaquin. The other medication used for high-risk patients. E, evaluate with CURB 65. And S, strep pneumonia is the most common form of CAP. So, if you saw these answer choices, you would notice that azithromycin and doxycycline are both in the MAD treatment. The answer choices that it's given, if you knew nothing about pneumonia, but you did know MAD, crackles, you're going to know that your answer choices, they're not going to give you both azithromycin and doxycycline. So cross those both out. And if you're now thinking, wait, what? Why? Both treatments are for CAP, the macrolide and doxy. So we automatically cross them out. That makes no sense at all because we just said that they were both treatments for CAP pneumonia. But remember, you can only pick one answer. So both answers, they're automatically wrong. Because honestly, what this question is really asking, it is actually asking, what is the most appropriate treatment for a high-risk patient with CAP pneumonia? Now, this question becomes very simple. Bactrim, it's not a treatment for pneumonia. So that leaves you with one answer. So even if you didn't know this question at all and didn't know how to answer it, you do now. Let me know below if this was helpful, and I will keep making these videos.